Question 1. A 6-month-old infant presents with vomiting, diarrhea, and irritability. What is the priority nursing intervention to prevent complications from dehydration? A. Administer IV fluids immediately. B. Begin oral rehydration with electrolyte solutions. C. Encourage breastfeeding every 30 minutes. D. Perform a full neurological assessment. Answer. B. Begin oral rehydration with electrolyte solutions. Rationale: oral rehydration solutions, ORS, are the first-line treatment for dehydration in infants with mild to moderate symptoms. IV fluids are indicated if the child cannot tolerate oral intake or in cases of severe dehydration. Question 2. A 5-year-old child with cystic fibrosis presents with increasing difficulty breathing and a productive cough. Which of the following should be prioritized in the nursing care plan? A. Administer supplemental oxygen to maintain oxygen saturation above 92%. B. Initiate respiratory physiotherapy and chest physiotherapy. C. Start broad-spectrum antibiotics immediately. D. Assess the child's dietary intake and hydration status. Answer. B. Initiate respiratory physiotherapy and chest physiotherapy. Rationale: respiratory physiotherapy is crucial in managing respiratory symptoms in cystic fibrosis. Chest physiotherapy helps clear thick mucus and prevent further lung damage. While oxygen and antibiotics may be necessary, physiotherapy is the priority to improve breathing. Question 3. A 2-year-old child is admitted with severe asthma exacerbation. What is the priority nursing intervention to improve respiratory status? A. Administer nebulized albuterol immediately. B. Administer corticosteroids orally. C. Ensure the child is positioned upright to facilitate breathing. D. Obtain arterial blood gases, ABG, to assess oxygenation. Answer. A. Administer nebulized albuterol immediately. Rationale: albuterol is a fast-acting bronchodilator used to relieve bronchospasm during asthma exacerbations. While positioning and corticosteroids are important, the immediate relief of airway constriction with a bronchodilator takes priority. Question 4. A pediatric patient presents with a fever of 40 degrees Celsius, 104 degrees Fahrenheit, and a rash that started at the torso and spread to the extremities. Which of the following diagnoses is the most likely? A. Chickenpox, varicella. B. Measles, rubeola. C. Scarlet fever. D. Fifth disease, erythema infectiosum. Answer. B. Measles, rubeola. Rationale: measles presents with a high fever, rash starting on the face and spreading to the body, and conjunctivitis. Chickenpox typically starts on the trunk and has a more pruritic rash. Scarlet fever and fifth disease have distinct rash patterns and symptoms. Question 5. A 4-year-old is admitted with acute glomerulonephritis following a recent throat infection. What is the priority assessment finding to monitor? A. Urine output and color. B. Blood pressure and signs of hypertension. C. Respiratory rate and oxygen saturation. D. Electrolyte levels, specifically potassium. Answer. B. Blood pressure and signs of hypertension. Rationale: glomerulonephritis can lead to fluid retention, which may cause hypertension. Monitoring blood pressure is essential to detect complications such as hypertensive encephalopathy or heart failure. Question 6. A child with leukemia is receiving chemotherapy. The nurse notes the child is neutropenic with a fever of 39 degrees Celsius, 102.2 degrees Fahrenheit. What is the priority intervention? A. Administer acetaminophen to reduce the fever. B. Draw blood cultures and start broad-spectrum antibiotics. C. Encourage fluid intake to prevent dehydration. D. Place the child in protective isolation. Answer: B. Draw blood cultures and start broad-spectrum antibiotics. Rationale: neutropenic fever in a child with leukemia requires immediate action with blood cultures and broad-spectrum antibiotics to identify and treat potential infections. Acetaminophen may mask symptoms, and fluid intake is secondary in this emergency situation. Question 7. A 10-year-old child with type 1 diabetes presents with symptoms of nausea, vomiting, and fruity-smelling breath. What is the most likely complication, and how should it be managed? A. Hypoglycemia. Administer a fast-acting carbohydrate. B. Diabetic ketoacidosis, DKA. Initiate IV fluids and insulin. C. Hyperglycemic hyperosmolar syndrome, HHS. Administer insulin. D. Insulin shock. Administer glucagon. Answer: B. Diabetic ketoacidosis, DKA. Initiate IV fluids and insulin. Rationale: the symptoms of nausea, vomiting, and fruity breath point to DKA, a serious complication of type 1 diabetes. Immediate management involves IV fluids, insulin, and electrolyte monitoring. Hypoglycemia and insulin shock would present with different symptoms. Question 8. A child with a history of recurrent otitis media presents with ear pain, fever, and irritability. What is the priority nursing action? A. Administer pain medication as prescribed. B. Inspect the ear for signs of infection. C. Educate the parent on the use of antibiotics. D. Obtain a hearing assessment. Answer: B. Inspect the ear for signs of infection. Rationale: inspection of the ear is crucial to assess for signs of infection, such as fluid, redness, or bulging of the eardrum. Pain medication may be needed, but identifying the cause of symptoms is the priority. Question 9. A 16-year-old is admitted with severe abdominal pain, vomiting, and bloating after consuming a large amount of alcohol. What complications should the nurse monitor for? A. Gastrointestinal bleeding. B. Hepatic encephalopathy. C. Acute pancreatitis. D. Bowel obstruction. Answer: C. Acute pancreatitis. Rationale: acute pancreatitis is a potential complication of excessive alcohol consumption, characterized by severe abdominal pain, vomiting, and bloating. Monitoring for gastrointestinal bleeding or bowel obstruction is important, but secondary to pancreatitis in this context. Question 10. A 2-month-old infant has been diagnosed with hyperbilirubinemia. What is the most appropriate intervention? A. Administer antibiotics to prevent infection. B. Encourage breastfeeding every 2 hours. C. Start phototherapy immediately. D. Perform a lumbar puncture to rule out infection. Answer: C. Start phototherapy immediately. Rationale: phototherapy is the most effective treatment for neonatal hyperbilirubinemia. While breastfeeding is important for hydration, phototherapy addresses the root cause by breaking down bilirubin. Antibiotics and lumbar puncture are not indicated unless there is suspicion of infection. Question 11. A 7-year-old child is admitted for a suspected foreign body aspiration. Which assessment finding would indicate immediate intervention? A. Low-grade fever and cough. B. Difficulty swallowing and drooling. C. Wheezing and tachypnea. D. Cyanosis and decreased breath sounds on one side. Answer: D. Cyanosis and decreased breath sounds on one side. Rationale: cyanosis and decreased breath sounds are indicative of airway obstruction, which is an emergency and requires immediate intervention, such as removal of the foreign body. Question 12. A child with sickle cell anemia is admitted with severe pain. Which intervention should the nurse prioritize? A. Administer opioid analgesics as prescribed. B. Encourage the child to walk around to relieve pain. C. Initiate a blood transfusion. D. Provide oxygen to improve oxygenation. Answer: A. Administer opioid analgesics as prescribed. Rationale: sickle cell pain episodes are managed primarily with analgesics. While oxygen therapy may be used in severe cases, pain control is the immediate priority to improve the child's comfort. Question 13. A child is admitted with a suspected case of Kawasaki disease. Which of the following would be the priority assessment? A. Assessing for mucosal changes and erythema of the hands and feet. B. Checking for the presence of a maculopapular rash. C. Evaluating the child's mobility and joint function. D. Monitoring for signs of shock and hypotension. Answer: A. Assessing for mucosal changes and erythema of the hands and feet. Rationale: the hallmark signs of Kawasaki disease include mucosal changes, strawberry tongue, erythema of the palms and soles, and a high fever. Early identification of these signs allows for appropriate treatment. Question 14. A 9-year-old child with an implanted port for chemotherapy asks the nurse about the risk of infection. What is the most appropriate response? A. Infection is a major risk, so the port should be kept sterile at all times. B. You do not need to worry about infection because chemotherapy does not affect your immune system. C. You can perform normal activities as long as the port is covered with a bandage. D. The port is generally very safe and infection is very rare. Answer: A. Infection is a major risk, so the port should be kept sterile at all times. Rationale: children with implanted ports are at increased risk for infection due to immunosuppression and the need for sterile procedures when accessing the port. Proper care and hygiene are essential to prevent infection. Question 15. A 15-year-old girl with anorexia nervosa is admitted for refeeding syndrome. Which of the following laboratory findings is most concerning? A. Decreased potassium levels. B. Elevated liver enzymes. C. Increased serum glucose levels. D. Decreased phosphate levels. Answer: D. Decreased phosphate levels. Rationale: refeeding syndrome is characterized by severe electrolyte imbalances, particularly hypophosphatemia. This can lead to life-threatening complications such as cardiac and respiratory failure. Monitoring phosphate levels is critical during refeeding. Question 16. A child with a cleft lip and palate undergoes surgery for repair. What is the most important post-operative care consideration? A. Positioning the child on their stomach to prevent aspiration. B. Ensuring the child does not cry to prevent strain on the surgical site. C. Feeding the child through a straw immediately after surgery. D. Administering analgesics to manage pain and discomfort. Answer: B. Ensuring the child does not cry to prevent strain on the surgical site. Rationale: crying can put strain on the surgical site, leading to complications. Pain management is also crucial, but preventing crying is the most important immediate consideration. Question 17. A child with a history of asthma is prescribed a long-acting beta agonist, LABA, for daily use. What should the nurse include in the teaching plan? A. Use this medication during an acute asthma attack for immediate relief. B. This medication helps control asthma symptoms, but does not provide immediate relief during an attack. C. Use this medication only when you are exercising. D. Stop using the inhaler if you feel better after a few days. Answer: B. This medication helps control asthma symptoms, but does not provide immediate relief during an attack. Rationale: LABAs are used for long-term control and are not intended for acute relief of asthma symptoms. Short-acting bronchodilators are used during an acute attack for immediate relief. Question 18. A 10-year-old is receiving chemotherapy and is at risk for neutropenia. Which of the following interventions is a priority to reduce the risk of infection? A. Avoiding contact with visitors and other children. B. Administering prophylactic antibiotics daily. C. Encouraging frequent hand washing and good hygiene. D. Restricting all activities, including school attendance. Answer: C. Encouraging frequent hand washing and good hygiene. Rationale: good hygiene and hand washing are the most effective preventive measures for reducing the risk of infection in neutropenic children. Isolation and antibiotics may be necessary, but hygiene is the first line of defense. Question 19. A pediatric patient is diagnosed with a UTI. Which intervention should be prioritized in their care? A. Administer a single dose of oral antibiotics. B. Perform a catheterization to obtain a urine sample. C. Increase fluid intake to flush out bacteria. D. Begin IV antibiotics immediately. Answer: C. Increase fluid intake to flush out bacteria. Rationale: increasing fluid intake helps flush bacteria from the urinary tract, which can help resolve the infection. While antibiotics are essential, fluid management should be prioritized as part of the treatment plan. Question 20. A 5-year-old with sickle cell disease is experiencing an acute pain crisis. What is the most appropriate nursing intervention? A. Encourage the child to engage in physical activity to promote circulation. B. Administer pain medications, including opioids, as prescribed. C. Initiate hydration therapy through IV fluids. D. Perform a comprehensive neurovascular assessment. Answer: B. Administer pain medications, including opioids, as prescribed. Rationale: the priority intervention for a pain crisis in sickle cell disease is pain management. Opioids are often necessary for severe pain. Hydration is also important, but controlling pain takes precedence during crisis. Question 21. A 3-year-old child with chronic respiratory issues is being discharged after a hospitalization for an asthma exacerbation. Which instruction is the most important to include in the discharge teaching? A. Make sure to use your inhaler only when you feel short of breath. B. Monitor your peak flow meter daily to assess for early signs of an asthma attack. C. Avoid all physical activities that may cause shortness of breath. D. Only take steroids if you experience symptoms of an asthma attack. Answer: B. Monitor your peak flow meter daily to assess for early signs of an asthma attack. Rationale: daily peak flow monitoring is essential for early detection of asthma exacerbations. Using the inhaler during symptoms alone and avoiding physical activities entirely are not ideal strategies for asthma management. Question 22. A 7-year-old child with a new diagnosis of type 1 diabetes is learning about insulin therapy. What should the nurse emphasize in the teaching plan? A. It is important to take insulin even if you are not eating. B. You should only monitor your blood sugar if you feel sick. C. Insulin should be injected into the muscle for faster absorption. D. Once you start insulin, you will no longer need to check blood sugar levels. Answer: A. It is important to take insulin even if you are not eating. Rationale: insulin is required regardless of food intake because it controls blood sugar levels throughout the day. Blood sugar monitoring is necessary even when feeling well, and insulin should be injected subcutaneously, not into muscle. Question 23. A 2-year-old child presents with a sudden onset of high fever, a red maculopapular rash, and irritability. What is the most likely diagnosis? A. Rosella. B. Measles. C. Fifth disease. D. Scarlet fever. Answer: A. Rosella. Rationale: Rosella typically presents with a high fever followed by a characteristic rash once the fever subsides. Measles and scarlet fever have distinct rashes, while fifth disease has a slapped cheek appearance. Question 24. A 4-year-old child is undergoing chemotherapy for leukemia. Which of the following would be the most concerning finding related to the child's neutropenia? A. Mild rash on the arms and legs. B. Complaints of a sore throat and fever of 38.5 degrees Celsius, 101.3 degrees Fahrenheit. C. Slight abdominal tenderness. D. Fatigue and decreased appetite. Answer: B. Complaints of a sore throat and fever of 38.5 degrees Celsius, 101.3 degrees Fahrenheit. Rationale: a sore throat and fever are concerning signs of infection in a neutropenic child and should be evaluated immediately to prevent sepsis. The other symptoms, though important, are less urgent in comparison. Question 25. A 9-month-old infant is being evaluated for developmental milestones. Which of the following is a red flag that requires further evaluation? A. The infant can sit without support. B. The infant begins to crawl. C. The infant has not started babbling. D. The infant can transfer objects between hands. Answer: C. The infant has not started babbling. Rationale: by 9 months, infants should begin babbling. Delays in speech development, such as failure to babble, may indicate developmental delays or hearing impairment. Question 26. A child with a history of nephrotic syndrome presents with edema, foamy urine, and weight gain. What is the priority nursing intervention? A. Administering diuretics as prescribed. B. Monitoring vital signs and oxygen saturation. C. Encouraging high-protein, low-sodium diet. D. Weighing the child daily and monitoring urine output. Answer: D. Weighing the child daily and monitoring urine output. Rationale: monitoring weight and urine output is essential in assessing fluid retention in nephrotic syndrome. Diuretics, diet, and vital signs may be important later, but daily weight is a key indicator of fluid status. Question 27. A 10-year-old child is admitted with a diagnosis of acute appendicitis. Which of the following would be the most concerning sign of impending perforation? A. Decreased appetite and mild nausea. B. A sudden relief of pain followed by an increase in fever. C. Generalized abdominal tenderness on palpation. D. Increased white blood cell count and persistent fever. Answer: B. A sudden relief of pain followed by an increase in fever. Rationale: a sudden relief of pain followed by worsening fever is a classic sign of appendix perforation, as it can lead to peritonitis. Generalized tenderness and fever are also concerning, but less specific. Question 28. A child with a history of seizures is admitted to the hospital with a fever of 40 degrees Celsius, 104 degrees Fahrenheit. What is the priority nursing intervention? A. Administer antipyretics to reduce fever. B. Perform a full neurological examination. C. Check the child's blood glucose levels. D. Place the child in a cooling blanket. Answer: A. Administer antipyretics to reduce fever. Rationale: fever management with antipyretics is essential in preventing febrile seizures in a child with a history of seizures. Monitoring glucose and neurological assessment are important, but fever reduction is the first step. Question 29. A child with a history of recurrent ear infections is being evaluated for tympanostomy tube placement. What is the most important preoperative consideration? A. Ensuring the child is immunized for pneumococcal disease. B. Assessing the child's hearing and language development. C. Providing the child with antibiotics before the procedure. D. Performing a tympanometry test to assess fluid levels. Answer: B. Assessing the child's hearing and language development. Rationale: preoperative assessment should include evaluating the child's hearing and language development, as chronic ear infections may affect these areas. Immunizations and antibiotics are important, but secondary considerations. Question 30. A 4-month-old infant is diagnosed with congenital hypothyroidism. What is the priority treatment? A. Administer thyroid hormone replacement therapy. B. Schedule a follow-up ultrasound of the thyroid gland. C. Recommend a high-calcium diet. D. Begin physical therapy for motor delays. Answer: A. Administer thyroid hormone replacement therapy. Rationale: thyroid hormone replacement therapy is the primary treatment for congenital hypothyroidism to prevent developmental delays and growth issues. Follow-up imaging or therapy may be needed later, but is not the priority at diagnosis. Question 31. A 6-year-old child is brought to the clinic with a persistent dry cough, wheezing, and shortness of breath after playing outside. What is the nurse's priority action? A. Administer a bronchodilator as prescribed. B. Perform a spirometry test to assess lung function. C. Give the child a corticosteroid inhaler. D. Take a complete health history and assess for allergens. Answer: A. Administer a bronchodilator as prescribed. Rationale: administering a bronchodilator is the priority to relieve bronchospasm and improve airflow during an asthma attack. The other actions are important, but secondary to providing immediate relief. Question 32. A 16-year-old female with anorexia nervosa is admitted with dehydration, electrolyte imbalance, and cardiac arrhythmias. What is the priority nursing intervention? A. Initiating IV fluids with potassium replacement. B. Administering antiemetics to prevent vomiting. C. Providing a high-calorie, high-protein diet. D. Monitoring daily weights and urine output. Answer: A. Initiating IV fluids with potassium replacement. Rationale: the priority is correcting dehydration and electrolyte imbalances, especially potassium, which can cause cardiac arrhythmias. Nutritional support and monitoring come afterward once acute issues are addressed. Question 33. A 3-month-old infant is diagnosed with a ventricular septal defect (VSD). What is the priority nursing intervention? A. Encourage breastfeeding to promote growth. B. Provide oxygen therapy to decrease workload on the heart. C. Monitor for signs of heart failure and respiratory distress. D. Prepare for surgical repair of the VSD. Answer: C. Monitor for signs of heart failure and respiratory distress. Rationale: monitoring for heart failure and respiratory distress is critical in children with VSD. While breastfeeding and oxygen therapy are important, early identification of worsening symptoms is the priority. Question 34. A 12-year-old child with a history of chronic asthma is found to be in respiratory distress. What should the nurse do first? A. Administer the prescribed inhaled bronchodilator. B. Prepare for intubation and mechanical ventilation. C. Administer oral corticosteroids. D. Obtain an arterial blood gas sample. Answer: A. Administer the prescribed inhaled bronchodilator. Rationale: the first step in managing asthma exacerbation is to relieve bronchospasm with a bronchodilator. Intubation or corticosteroids may be needed later if the child does not improve. Question 35. A 6-month-old infant is diagnosed with bacterial meningitis. What is the priority nursing action? A. Administer antibiotics as prescribed. B. Start pain management with acetaminophen. C. Perform a thorough physical exam to rule out other conditions. D. Monitor vital signs every 4 hours. Answer: A. Administer antibiotics as prescribed. Rationale: early administration of antibiotics is critical in treating bacterial meningitis. Pain management and monitoring are important, but antibiotics should be given immediately after cultures are obtained. Question 36. A 2-year-old child is diagnosed with a urinary tract infection, UTI, and is prescribed antibiotics. What is the priority nursing intervention? A. Ensure that the child finishes the entire course of antibiotics. B. Educate the parents about proper hygiene practices. C. Encourage the child to drink more fluids to flush out bacteria. D. Perform a urine culture to confirm bacterial sensitivity. Answer: A. Ensure that the child finishes the entire course of antibiotics. Rationale: completing the entire course of antibiotics is critical to prevent the recurrence of infection. Hydration and hygiene are also important, but secondary to ensuring proper treatment compliance. Question 37. A child with cerebral palsy is receiving a feeding tube for nutrition. What should the nurse prioritize in the care plan? A. Monitor for signs of aspiration during feedings. B. Ensure that the child has adequate physical therapy to promote motor development. C. Schedule regular speech therapy sessions. D. Encourage family to introduce oral foods at every opportunity. Answer: A. Monitor for signs of aspiration during feedings. Rationale: children with cerebral palsy are at risk for aspiration, so careful monitoring during tube feeding is essential. While physical and speech therapy are important, preventing aspiration is the priority during feedings. Question 38. A 10-year-old child presents with progressive muscle weakness, difficulty swallowing, and ptosis. What is the most likely diagnosis? A. Duchenne muscular dystrophy. B. Myasthenia gravis. C. Guillain-Barré syndrome. D. Cerebral palsy. Answer: B. Myasthenia gravis. Rationale: myasthenia gravis presents with progressive muscle weakness, ptosis, and difficulty swallowing. Duchenne muscular dystrophy primarily affects larger muscle groups and has a different presentation. Guillain-Barré typically presents with rapid onset of weakness. Question 39. A 4-year-old child presents with blood in the stool and abdominal pain. What is the priority nursing action? A. Obtain a stool sample for analysis. B. Administer pain medication to relieve discomfort. C. Prepare the child for an abdominal ultrasound. D. Assess for signs of dehydration. Answer: A. Obtain a stool sample for analysis. Rationale: a stool sample is necessary to determine the cause of the bleeding, e.g., infection, bleeding disorder, or gastrointestinal condition. While hydration and pain management are important, identifying the cause of the bleeding is the priority. Question 40. A child with a known peanut allergy presents with a sudden onset of wheezing, swelling, and difficulty breathing. What is the priority intervention? A. Administer epinephrine immediately. B. Administer a bronchodilator via nebulizer. C. Apply an ice pack to the face to reduce swelling. D. Provide oxygen and place the child in a high Fowler's position. Answer: A. Administer epinephrine immediately. Rationale: epinephrine is the first-line treatment for anaphylaxis and should be administered immediately to counteract the allergic reaction. The other interventions are supportive, but secondary to epinephrine in a life-threatening situation.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.